is, why do we need to vaccinate our children if they're not getting as sick? And we really need to look at what the evidence says. Yes, for the majority of children, COVID-19 is a relatively mild illness, but not for every child. And we hear a lot of ableism on the ground about underlying health conditions, and only the previously sick are getting really sick. And this just isn't the case. All children are at risk for complications from COVID-19. As of November 9th, children in the 5 to 11 age group represent 7.5% of all COVID infections in Canada, 0.3% of hospitalizations, 0.3% of ICU admissions, and 0.007% of case deaths. So recently, 5 to 11-year-olds have become the population with the highest incidence of confirmed COVID-19 infections, although thankfully their rate of hospitalization has remained low. Experts are saying that it is likely that most 80% or more of unvaccinated people, which currently includes these children, will contract COVID-19 in the next 6 to 12 months. This is concerning because death is not the only negative outcome from COVID infection. Children suffer from complications, including myocarditis, at a rate 10 times or more than that of which has been seen with vaccination. They also suffer from multi-system inflammatory syndrome and long COVID. This is not a discussion about the risks versus benefits of COVID vaccine versus no vaccine. It's truly a discussion of the risks versus benefits of the COVID vaccine versus COVID infection. And on this, the science is very clear. The vaccines are safe and they are effective. On your screen, you'll see one of two slides shared from a communication group of which I am a part. We call ourselves Focused COVID Communications. We are volunteers who came together during the early days of the AstraZeneca questions. We want and continue to want to provide clear and evidence-based commentary on the COVID vaccines during and at times turbulent rollout. The first slide here we've entitled Vaccinate Now or Wait. We don't feel that not vaccinating is a good or safe option for most people, children included, hence the vaccinate or wait. Further to this, we developed an FAQ for COVID-19 vaccines in children, which is the next slide, which was released last Friday following Health Canada's approval of the vaccine for children and the NACI guidance statements. Since this was released, multiple groups have come out with additional statements of guidance, and I think one we need to include and focus on is that from the Canadian Pediatric Society. The submitted clinical trials of the Pfizer-BioNTech vaccine included over 3,000 children who received the vaccine and 750 who received the placebo. Follow-up varied from 2 weeks to 2 months. Children who got 2 doses of Pfizer COVID-19 vaccine had a 91% lower chance of getting sick with COVID-19. The Pfizer vaccine protects children from getting sick with the Delta variant. As expected, local reactions were common and included pain at the injection site, fatigue, chills, and fever. There were no cases of myocarditis or pericarditis or any other serious event. Although these studies were not powered to capture extremely rare things that happen less than 1 in 1,000 rate of adverse events, the studies are ongoing and will follow the participants for the next 2 years. To date, over 3 million pediatric vaccine doses have been given in the United States with no severe adverse events, including no diagnosed cases of myocarditis. With respect to myocarditis, we expect the rates will be lower in this pediatric population than the youth population for a couple of reasons, including a lower dose and an increased time gap between doses. Myocarditis seemed to peak in older male youth around the 16 to 17-year-old age group. Other concerns we've heard repeatedly about this vaccine include concerns about fertility. However, it is known that the mRNA is broken down and eliminated by the body in about 3 to 4 days, and the resultant spike protein also leaves the body in about a week or so. It's worth noting that the exposure to the viral mRNA and spike protein will be much greater from a COVID-19 infection. The vaccine cannot impair fertility in any way. The vaccine is a 10 microgram dose of the Pfizer-BioNTech pediatric formulation given as a 0.2 milliliter volume. The orange cap vials are hitting pharmacy shelves this week. I received my first 100 today and will be vaccinating my own children on Friday. NACI has recommended that all children 5 to 11 may be offered a dose 56 days apart, a 2-dose series, 56 days apart. The Canadian Pediatric Society recommends the COVID-19 be offered simultaneously with other required vaccines unless there is assurance that timely administration of the other vaccines, for example, a flu shot, will not be compromised. Many children have missed routine immunizations during this pandemic. The Ontario Pharmacists Association has also indicated that concomitant administration of the COVID vaccine and others, including the flu shot, should be considered at the discretion of the pharmacist. We are on the front lines giving patient information. And I know there's been so much coming at us this year. The rollout has been anything but smooth. There are many fantastic resources out there to stay on top of the evidence to ensure you feel comfortable counseling your patients. The slides I've posted here are available through the University of Waterloo School of Pharmacy COVID vaccine resource page. Are also available on my pharmacy website, along with many others that we've developed.
Thank you so much, Kristen. I think that's a really good starting point for this conversation. It's clear that it's unclear, but the one thing that we do know is vaccinating our children is the way out and the way to go. And I'm really hoping that through these conversations, we're going to instill confidence not only in our parents and our children, but also as healthcare providers. You know, anxiety about vaccinations is not unique. And it is something that I'm hoping we're going to be able to address for everyone involved. You know, just the idea of vaccinating children probably gives a lot of healthcare providers a bit of anxiety as well, which is why I'm assuming many of you are here. So let's talk about it. And with that, I'm going to turn it on over to Anna Taddeo to walk us through some different strategies that healthcare professionals can use to address needle fear and anxiety in children, and how we can continue to promote vaccine confidence in everyone involved.
Many thanks, Danielle, and thanks for the opportunity to participate in today's session. It's very important. And thank you, Kristen, for the opening remarks. I think they're also really important. And part of the anxiety of vaccination is the anxiety that pharmacists are also having with having to deal with all these questions in ways that they've never had to do before. So everyone knows probably that by now over 80% of the population of Canada that's 12 or above and that was eligible for vaccinations has already been vaccinated. And what you see on your screen right now is the results of an Angus Reid survey done in the middle of October, asking parents if they would vaccinate their kids aged between 5 and 11 when the vaccine came out. And so, of course, the vaccine is now approved. At that time, about half of parents said that they would. And then you have a lower percent, about 1 in 5 saying that they will, but probably not in the beginning. They'll wait. And then some people said that they won't. So what we're really focusing on right now is actually talking about how we're going to manage the 50% that are ready to vaccinate their kids. And if we do a really good job and they have really good experiences, they'll come back for the second dose. And as well, we might get some of those others who are not sure, they're on the fence, feeling more comfortable with getting vaccinated. So that's where the focus of our discussion is going to be. So I want to start off by setting the context for pediatric vaccination, really from the perspective of the child, who is the client here and the recipient of the service. So studies show that the primary concern of kids when it comes to vaccinations and other other health contexts and procedures is the needle. And vaccinations are the most common reason that people receive needles all over the world. Injection pain is the most common side effect following immunization, which we refer to as adverse events following immunization, or AFI, even though we don't really acknowledge pain as one. The amount of pain that someone feels is subjective. That is, it's an individual experience, and we don't know how it feels for anybody but ourselves. And importantly, children are more vulnerable to needle pain and negative experiences. So children report more pain and are more bothered by needles than adults are. About 2/3 of kids are afraid. So really, you should expect that this is the norm, not the other way around, that if you have a child who's afraid, that's kind of unusual. It's actually what you should be expecting. And about 1/4 of adults are afraid. And the way people get afraid is usually with a bad experience with the needle in the past, but they don't have to have had a bad experience. They could also be made afraid by something someone's told them or by something they see. So this is where setting up environments and vaccination procedures to try to not provoke fear becomes important. Being afraid can increase pain. So you can actually feel more pain if you're more afraid, but you can also have other what we call immunization stress-related responses. So you can feel dizzy, headache, nausea, fainting, this sort of stuff. And fainting's sort of the extreme side effect. And it can also lead to vaccination delay or refusal as people avoid things that make them anxious or afraid. So needles would be no different. And across different studies, about 1 in 10 people avoids or delays vaccination because they have concerns about pain and fear. So it doesn't seem like a lot, but when we're trying to vaccinate the population, it becomes a lot, and we want to prevent this from happening, and we have things that we can do. So we've been studying this for quite a while, providing or developing primary evidence, and then also synthesizing it and creating clinical practice guidelines. And what you see on this slide is a summary of our most recent clinical practice guideline, which we published in 2015. And we divided the guideline into 5 categories of recommendations. Across the bottom, you can see what they are. So we included recommendations for procedural interventions, physical, pharmacological, and psychological. So these were different buckets of types of things you could do to reduce immunization stress-related responses. Procedural are injection technique type things. Physical interventions have to do with body positioning and activity. Pharmacologic are the drugs, and psychological have to do with thoughts and behaviors. And the one on the bottom right, which we call the process interventions, is basically how we get everybody to do the first 4. And what I'm going to do over the next couple of slides is, or a few minutes and few slides, is talk about some of the interventions in each of these first 4 categories that apply to school-age children, and then also talk about how we do this, or the process part. So with respect to procedural interventions, or I said the injection techniques, this is stuff that the immunizer can control, and they can apply this independently for all patients. If you're administering vaccines intramuscularly, avoid aspiration. This is an unnecessary step. It adds a lot of needle contact time and shearing and tissue damage, and increases pain. Also inject vaccines quickly, over 1 to 2 seconds, as this is associated with less pain than slow injections, which was the traditional way of giving an injection. Physical interventions, as I said, have to do with body positioning and activity. And what you see on this slide are some comfort positions that can be used in kids. The idea is that kids sit upright so they feel more in control, but also that they're held in a secure way so that they can be kept still, but not restrained. So this allows the limbs to be exposed and accessed for vaccinations. And the types of comfort positions people would choose would depend on how old the child age is, as well as how afraid they are. So younger kids and more fearful kids would be more supported. So they would be looking like, the top left picture, or maybe the child would even be turned around in a chest-to-chest type of position with the parent. And older kids and kids who are less fearful might want to sit beside their parent, but still appreciate the physical touch of a parent, as that would give them comfort. This slide summarizes the pharmacological interventions. Basically, we have topical anesthetics that we can offer to kids and adults, so people of all ages. And despite the fact that these medications don't penetrate the skin beyond a few millimeters, they actually do work to reduce pain from intramuscular as well as subcutaneous injections. There's a few logistical challenges to their use. They require time to work. They also cost money, so you need to plan for them ahead of time. But they're actually quite a game changer and a very good option for kids who are usually between the ages of 4 and 8 or 9 that can be very frightened of needles. The 4th category of interventions is psychological interventions. And this is the first of 2 slides on this particular category of interventions. And so you may not think of this this way, but vaccination is a social event. It doesn't just involve the person who's getting vaccinated, but also immunizers who are there. And if it's a child, then parents, and then possibly siblings. And how people are acting and what they're saying can affect the experience for that child or the person who's being vaccinated. There can be things that people do that increase distress, and we call those distress promoting behaviors. And there could be things that people do that promote coping, and we call those coping promoting behaviors. And obviously we want to get people to use coping promoting behaviors more than distress promoting behaviors. And at the top of the slide, you could see some examples of ways you could say things that would be promoting distress rather than coping. So saying something in a neutral way, like "here I go" instead of "here comes the bee sting," would be preferred. Not providing kids with false reassurance, or otherwise calling it lying by suggesting that the needle won't hurt, is also advised, because not only is this ineffective, but it actually breaks down trust. So the kids won't trust you and anything you say after that. And then finally, not ruminating or not paying too much attention to the procedure and bringing kids' attention to it. So people may have good intentions and want to show empathy, but if they sort of focus on the procedure, it actually makes the kid more worried. So if a child was perfectly fine and distracted and not concerned, you're kind of bringing their attention to the procedure. So instead, you want to be positive. You want to just help cope them. And you don't want to do things that increase anxiety or distress. So just be a positive coach and be positive energy, and kids will feel that everything is okay. So in the second category of distraction interventions, of psychological interventions, we have distraction. So distraction means taking someone's attention away from the procedure. And if we take our brain's attention away from pain, we actually experience less pain. In general, children are underutilized in their ability to help identify distractors that are effective for them. So they should be engaged in this process when they're old enough, and certainly kids that are 5 are old enough to know that they're going to get a needle and to start thinking about ways to help them cope with that needle. This way they learn to take control and they actually learn skills for self-coping, self-regulation. They're always going to be in stressful situations, and we don't need to sort of surprise them that they're going to have a needle and not have any coping strategies for it. And this is particularly important in the context of pandemic, when kids are already stressed and everybody's stressed. So we want people to be prepared ahead of time. So here on the slide, you see some suggestions for things that kids of different ages might want to do. Again, engaging kids in this conversation to find out what they want is important, and also finding out even if they want to be distracted at all. So this is one of those interventions that we all like to be able to recommend, but it's not suitable for everyone. In fact, it's estimated that about 1/3 of people don't want to be distracted during vaccination. They actually want to attend to the procedure, and that's their preferred coping strategy. So if you tell them to look away or do something else, they actually imagine things that are worse than what's really happening. So the idea is to ask people about their preferences for coping rather than imposing coping strategies on them. We also made some recommendations for people with high levels of fear and those who are prone to fainting. So for people who have extremely high levels of fear, where you would think it's just an unusual amount of fear in terms of how they're behaving, trying to escape, or very distressed, people may actually be too afraid to go through the procedure, or it may also be a good suggestion to tell them not to go through with the procedure because it may only further increase their stress and fear for the next time. And so this, if someone's very afraid of needles, even doing all the things that I told you about how managing pain and fear are not going to be helpful to them, and they need a different approach. They need someone to help them to become desensitized to the needle so they're less afraid, and then they can undergo the procedure with the regular pain management interventions. But this strategy is usually guided by a trained healthcare provider, usually a mental health expert like a psychologist. Needle fear can be associated with fainting. So people who are afraid are also more likely to faint, but you don't need to be afraid to faint. Oftentimes, we don't really have a good way to prevent this, or we don't think that there is, and we just kind of ask people, and then we're maybe a little bit more prepared if it does happen, but we actually have an intervention called muscle tension that we can employ to prevent this from happening. So people are simply asked to tense large muscle groups like their legs or their abdomen, and they can do this while they're sitting in a chair, either squishing their legs together or pressing down on their feet. And that can prevent the precipitous fall in blood pressure that happens when they faint. In addition to the 4 Ps, we made some good practice recommendations to address overarching aspects of the environment and the setting. So these are general strategies that reduce anxiety and fear. So you reduce fear cues. Those are visual and auditory. You reduce the amount of time people have to wait because they get more anxious, especially if they're standing. You provide privacy, comfort, and of course, respond to the individual and their needs. So now I'd like to move briefly to the 5th category of pain management, which we made recommendations for, and that's the process interventions I mentioned. So that's how we get everybody to do all this stuff. Well, that's where the CARD system was conceived. It was developed to help address this knowledge to care gap. So to turn that research evidence from the guideline recommendations to actionable steps. So basically the guideline tells you what to do, and then CARD tells you how to do it. So CARD involves a series of steps and measures that healthcare providers and institutions can follow before and during vaccination delivery. And each letter of the word CARD cleverly stands for a category of interventions that healthcare providers and individuals can play when getting vaccinated to reduce and prevent side effects and improve the experience. So CARD is kind of like rebranding these 4 Ps of pain management into a more user-friendly way. So it's knowledge translation. C stands for comfort, A stands for ask questions, R stands for relax, and D stands for distract. And here I'm going to show you some examples that people might want to play under those different CARD categories, CARD letter categories. So for C, somebody might want to wear a short sleeve shirt, so it's easier to access their arm and they don't have to disrobe, because that adds quite a bit of anxiety to a procedure for an individual. And a lot of people, surprisingly, actually do show up for vaccination with clothes that they need to take off. Ask questions. We're all nervous when we don't feel prepared. Sometimes people are afraid to ask questions, but give them permission to ask questions, and they can have those fears addressed and reduce their anxiety and fear. And they might learn about things. Kids would love to and do love to learn about topical anesthetics, and then that becomes an option for something that they do to help cope with the needle. For relax, somebody might ask for privacy. Often people don't want to be looking at others getting vaccinated, and they don't want others looking at them. And distract, people can choose to distract themselves with items that they bring, such as a cell phone, as is shown on this slide. So the CARD interventions really fall into 3 main categories, which I'm showing you here, these 3 separate circles inside a bigger circle. We have the environment and what you can do to make it comfortable and safe. We have education of the relevant stakeholders. So this is everyone who's involved in the process. They can happen ahead of time when people are getting information or booking, or it can happen on the day of, or both. And then it involves how you engage with the individual during the appointment. So I've included some suggestions for where the guideline recommendations might fit here. And they're not all represented, but you get some ideas about what you can think about to do in those different circles. So for instance, allowing people to sit down, minimizing fear cues like needles and other equipment, using coping promoting behaviors and injection techniques that minimize pain, and inviting people to actually be part of the process and to play their cards. So to have their own coping strategies. And what CARD really essentially is doing is operationalizing a patient-centered approach to giving vaccinations, which is what we're all trying to do. We're all acting as pharmacists, as care providers. That's one of our roles. To date, CARD is the only vaccination delivery framework that's been tested and proven to improve attitudes and knowledge about reducing pain and fear, improve vaccination safety by reducing immunization stress-related responses. So this includes fear, pain, dizziness, and fainting, and improve the vaccination experience for not only kids, but the other adults that are there with them. We have tools and resources on the websites you see. They really all point to each other, and the resources are housed actually through the Hospital for Sick Children and About Kids Health. So they're kind of derived from there. And there are QR codes that people can use, which are on this slide, that they would be able to access to get to a lot of the different types of things that we have to offer for people, depending on where you work and who you want to give this information to. They can be shared at booking, so parents can get information about how they play their cards, how their kids play their cards, and they can be posted as well in the pharmacy and shared on the day of. So there are posters, for example, that people can use. I'm going to end with a video to show you what CARD looks like. And this is a grade 7 student. So the student would be about 12 years old getting a vaccine, and you'll notice she's fearful, but you can see how the nurse coaches her and that she's come prepared because she's learned and she's decided what coping strategy she's going to use. So hopefully you'll be able to do this.
Some kids get really nervous with vaccines and some kids aren't nervous at all. Let's say we had a scale of 0 to 3. 0 is going to be the lowest. Where would you say you are on that scale? So So that's pretty high. So you remember the card system that Kelly just went over with you as well. What kind of card are you gonna play today that's gonna help you with that?
Relax and distract.
Nice. What kind of things are you gonna do to relax?
Deep breathing.
Right. Can you show me how you do that? Perfect. And what about distraction? Squishy? And I see you've brought a buddy with you too.
If the student brings a friend, ask the friend how they're going to help.
So you know what else can really help? If your buddy blows bubbles. Do you like bubbles? Bubbles can be fun. So I'm gonna have your buddy, what's your buddy's name? Brooke. Hi, Brooke. Do you think you can blow some bubbles while I get things ready here? Deep breath, blow. You're doing extremely well. One more, honey, and then you're done. Good job. You're completely done. What do you think? You did really, really well. And thanks, Brooke, for helping out.
Okay, so I've come to the end of my presentation and hope that you have some ideas for planning vaccinations in the pharmacy that can improve the experiences for kids and families as well as for yourselves. I thank you for your attention, and I want to hand it back to Danielle so we can hear about the experiences of the panel members about how they've implemented or plan to implement some of this stuff. Thanks very much.
That's wonderful. Thank you so much, Anna. So many really great tips. And, you know, the one thing that struck me in your presentation is that it is not a one size fits all. And we really do need to personalize the strategies to the individual patients. Not unlike most of our care, we are trying to be patient centered. So we'll invite the panelists to come together. And I'm going to start us off by asking Chantel, you know, I know that you have experience setting up a hospital clinic, and it was specifically focused in youth and children. Can you tell us a little bit more about that? Because we've heard about the theory, but I want to know, what was your experience on the ground level? What worked? What didn't work? Is there anything you can share?
Absolutely. So I have just brought a couple resources to show you guys today in terms of our clinic and how we set this up a little bit in the fall. So I am a nursing professional practice consultant from Children's Hospital here in London, Ontario. And one of the coolest parts of my job since coming into this role has been being able to work with our incredible team here at Children's to set up this vaccination clinic. And really the purpose of that was to meet the needs of children that we might not be able to meet in our traditional mass vaccination clinics, so we really kind of left it open to children and to families to say, you know, what needs do you have? Do you feel like your needs are able to be met at those clinics, or can we provide some additional supports to you? And so using a lot of the strategies that Anna has described so nicely tonight with the CARDS program, I think that's pretty consistent. So just to show you guys some of those resources we were able to provide, we kind of left the eligibility quite open. As you can see, this is just a quick little snapshot of what our internet page looks like if parents were looking to book at our clinic. So for example, the link to book right through our Middlesex London Health Unit is actually right there. It would take them right to booking into our clinic specifically, but it just kind of let parents know. So if you or your child have any sort of needle anxiety, general anxiety, additional sensory or behavioral needs, this clinic might be a great fit for you. And we know a lot of the time that if a child has fear or anxiety around painful procedures, that's also going to probably increase the anxiety for parents as well. And so being able to support that ahead of time and prepare both parties is really one of the key things that I think we were able to take away, one of the pearls of wisdom, if you will, from our experience over the last couple of months. So just a couple key points that we found were really, really helpful. Was number one, making the information very clear for families. Obviously, this is a really exciting time, but it's also a bit stressful trying to get all of our kiddos booked in to get those shots in arms. And the second thing was really just making sure that there are some great preparation resources for practitioners to be able to use, as well as families. So making that really child-friendly and making those things accessible. So one of the things we do have on our website is what we call My Comfort Plan. And this is is guided by the work that our hospital is doing around the Children's Comfort Promise. And so this is available to children and to families for them to have those conversations with their kids before coming to their appointment to say, you know, are there any challenges we might anticipate, or what sorts of things can we expect? So setting expectations with the child and also with the parent or family is really helpful, I think, to kind of letting them know what they can expect or what that process might look like when they get to the clinic itself. Again, this is just another piece of that comfort plan. So doesn't mean that they need to use all of these strategies, but whatever works for them. So having that conversation before they come into the clinic so that it doesn't feel like a surprise when they arrive. We're very fortunate, obviously, being in a hospital setting, we do have some resources that might not always be available in the community. So for example, child life specialists, we have been able to implement a system with our clinic that our child life specialists actually do a pre-phone call with those families if the parent or family requests it, or the child, obviously. And that can help them to walk through some of those challenges even before they arrive to clinic. The other thing that we've done has been some children and families really find it beneficial to come and do a tour of the clinic. So just to come see the space, see the environment, and know what to kind of expect again. We have had some children that have come to do a tour of the clinic and do really well for next time. Or the other piece of that is also that we're able to orient them to the clinic, say if they come for an appointment and it's just not the right day to get vaccinated. So maybe there are some additional challenges that we weren't able to anticipate, or it's taking a really long time, not pushing the child to say, okay, you've been here for 2 hours and you have to get your vaccine in today. It's okay to take breaks and it's okay to know kind of when they've hit their limit, right? So for parents, for families, as well as the child themselves as well. So kind of just meeting the child really where they're at. And I know that sounds really simple, but I think a lot of the time we don't give kids enough credit, and they're very smart and they know what's going on. And I know many of you probably have children yourself, and you probably know that better than anybody. So those are kind of just some of our key pearls. The only other thing really that we wanted to mention was just around our resource document for numbing cream. So we've actually in conjunction with our child life specialists who have done such a great job at putting this together. We were able to post this on our internet website as well, right, with the other resources. And that way, parents and families know that if this is a strategy that might work well for the child to obtain some Maxline and put that on at least 30 minutes before the injection, that they can do that. And sometimes even just that anticipation and knowing that they have that extra strategy in place is quite comforting for the child as well. So yeah, we've obviously learned a lot, I think, through this process. And you know, the other piece just being that we know a lot of the literature and the resources have been very adult focused. And so how do we make those things pediatric focused? So even signage and just creating that really warm environment and supportive environment that kids feel comfortable coming in right away. Those are just some of the strategies we've been able to put in place. And I'm so proud to work with such an amazing team of people that have been able to work on this and put it together. And we hope that some of that information will be helpful for you to share in your own practice.
Thank you so much, Chantel. I really, really appreciate all the learning. So I guess my question now is we've talked about the theory of needle fear and anxiety and how to address that. We've seen strategies in a child-focused vaccine clinic. How do we now take those learnings and those strategies and apply them into a community setting? You know, what is feasible? How can we incorporate this into an already busy environment? So I don't know if Kristen, do you have any thoughts on that?
Sure. So if possible, give lots of time for the time between injections. With adult COVID vaccines at my pharmacy, we were doing 2 patients every 5 minutes. With kids, we have 10 to 15 minute time slots blocked. We probably could do a family in a 10 to 15 minute time slot, but if they come as single kids, that's all we'll do in that time slot. We're in control of the booking software, and that's what we've decided to do. I think that's really important, just to give the time that's needed.
What about pre-visit to the pharmacy or pre-phone calls? How do you manage that?
So unfortunately, everybody who's listening right now is working in community pharmacy knows that we don't have time to call every patient prior to. It's just impossible at this time. So giving as much information as we can over our booking software about kind of what to expect and when to come, that's really important. Having an inviting atmosphere when they walk in is really important. Well, I'm in a small town, and many of the people that I will be vaccinating are regular patients. They've been here before for flu shots since we've been able to do flu from 2. We have a number of these kids that we've already done many years over, and the older kids of this group have come in many times, so they're used to us. It's great to have rapport. It's great to know moms and dads. When we were doing flu shots over flu shot season, great questions that we would ask were things like, what are you going to be for Halloween, and distraction techniques that would work if that was appropriate for that child. So Christmas focus, depending on culture and community, or other holiday focus, Hanukkah, etc. Take that into consideration and implement those conversations with your patients when they come in.
That's awesome. Can you take us or walk us through how you set up your clinic? Like, what were the things you were thinking about? What has worked well for you guys? And I'm saying this, but pharmacists have been vaccinating children for a while. Flu shots are part of that. So this idea is not new, but knowing the volume of children that will likely be coming in, what are some of the things that you did differently, or maybe you didn't do anything differently?
So I'm an independent pharmacy owner, so I have a massive amount of luxury in the ability to schedule any way I see fit, to hire anything I see fit. And we're in Ontario, so we're allowed to hire nurses to assist with the COVID-19 vaccination campaign. So we've done that. We're in the middle of a renovation, which makes it even more fun for us right now. We're also still doing flu shots. So Friday's our first day. We have 2 rooms running. We have 2 vaccinators going. We have people to check in to keep it extremely efficient. The goal is to minimize the time from entry to needle, because that's when the anxiety is going to probably be the highest. I know it will be for my kids. We may have a display of tiny Thai beanie babies out on the floor, and those are often held by the kids during their injections. We have a lot of Christmas decorations up. We have good music going. A lot of the nurses are moms. I'm a mom, so we're used to that environment with the kids, and just keeping it really positive and friendly and moving is really important. Kids who are standing still hearing other kids scream is going to make a big problem for us, and so we try to reduce that as much as possible.
That's awesome. Really, really great. So now that we've had a chance to hear from all of us, I'm going to turn it now to the questions that we're getting in the Q&A box, which is great. So we'll start off by asking, how do we do this in a time-sensitive environment? Some clinics have a shot every 5 minutes, so naturally there will be others waiting around. I have had kids take 20 minutes or more to calm down, and have parents insist on that shot, even though the suggestion has been made to come back another time. How do you navigate those conversations? There's the expectation of the child, and then there's the expectation of the parent, and sometimes it might get complicated.
So in our community pharmacy, it's important for me to give the autonomy to all the vaccinators to run their room, and remind vaccinators that we have an obligation not only to the people that are in the room, but the people who are waiting, and have conversations with mom and dad or caregivers, whomever they may be, that it doesn't look like this is going to happen right now, and I don't want to cause future trauma and future stress about ongoing vaccinations that the patient or the child is going to need. So why don't you step out, leave the store? You can decide if you want to come back in today. I'm not going to give away your dose, or you call me when you get home and we'll rebook you. And I know that we talked about how parents might push back on that and say, no, we're getting it today. I have other people who are waiting, who've booked appointments, and it's important for me to respect their time as well. So I must insist that you go. You're welcome to go outside. Come on back in as soon as you're ready. We'll put you right to the front of the line, but we've got to be ready to go then. Because we have that 15-minute window, this is not something I start with. This is something that we get to if I see the hesitancy. But I'm going to know that long before we get to 10 minutes or 15 minutes. It's either we're going to see that we're going to get there or not. And we'll employ all the tricks and the cards and the discussions. And we've got coloring sheets and a variety of other things But if we're not able to get there, we're going to talk to mom and dad kindly, but firmly, that it's time that we move on from this particular situation, because it's not going to have a good outcome for their child, especially considering future vaccinations.
Can I add on? I think that's a great answer, Kristen. I mean, you just said everything that you could possibly do. And I think what has to be maybe clear now, because there's such a volume, is to the parents that expectation up front. So if they can know ahead of time for sure, so then they're not sort of hearing it for the first time in the appointment and then getting distressed. And so if they know, so if part of that preparation has involved them knowing, listen, the appointment is 15 minutes, it is a little bit longer, but if it can't be done before that, the pharmacist might ask you to come back or take a break or come back or rebook. If people know that ahead of time, I think that would also be helpful in kids as well. So I think the big takeaway for me, for everyone, would be to prepare the patients ahead of time, to prepare families, because then they can be your allies and your partners in this. So not to have them be surprised when they come. So as much as you can, make it predictable and help them to know what to expect and what they can do to cope, to set everybody up for success. But then also, if it doesn't look like it's going to happen, then again, that's not going to be a surprise and cause further anxiety. People are going to be okay with that.
And I think the only other thing I guess I would add to that, maybe from our lived experience at our clinic this last few months, has really just been, having those conversations with kids before, because even if they don't know that they're going to be anxious walking in, they might know some of the things that, are already difficult for them. Even just sitting still is really difficult for a lot of these kids. And we have to remember that. And I mean, even when you look at the statistics, like from Immunize Canada, saying about 33 to 63% of children and adults already have some sort of needle anxiety or fear, right? We know that, you're kind of already starting behind the 8 ball a little bit. So how do we make it as positive of an experience as we possibly can? And I think about the first patient we actually had in the clinic back in September. She had gone to our mass vaccination clinic 2 or 3 times, and the staff were extremely supportive, really tried everything they could to, make that experience positive for her and be successful in getting that vaccination. I think it was a combination of her feeling a lot of pressure on her parents feeling a lot of pressure because they really wanted it to be successful. And I think just even by reducing some of the stimulation that she was under, giving her some other ways to, distract and do and play really those cards, right? It just really framed the experience very differently for her. And she was extremely excited. And we were, she's one of the biggest advocates to other children also to really seek out those resources and to come to the clinic if that meets their needs. And so just really one of our great success stories, I think, and obviously very near and dear to my heart, being a pediatric nurse myself. But, I think really all of those strategies, not every single one is going to work for every child. And just remembering every child is unique. Even if there are siblings that come in together, one child can be very different from the other. And just knowing it's not a failure, I think framing it that way is just really important.
Yeah, can I add a note there about the siblings? So a question we often get asked is, if there's more than one child, who do you vaccinate first? So I'm not sure if I want to say what I would do, but what do you do, Kristen? What's worked for you?
I vaccinate the one who wants it first, because I find that if they're not anxious, it calms their sibling, where if we vaccinate the anxious one who screams, then the calm one may start to wind themselves up. And this worked with my own 2 boys when we did their flu shot.
And Chantel, what's happened in the clinic in your experience?
I would say we see both. Obviously my practice over the years doing a variety of painful procedures, I think sometimes it can go either way. I think we really try to ask the family and sometimes involve the siblings even in that conversation. Sometimes they can positively kind of impact that situation as well. So I would say it's really on a case-by-case basis, but we've seen both for sure.
Yeah, that's a hard one, and which is why I asked everyone, because actually the sort of sciencey part of it would suggest actually vaccinating the most fearful first, because they only get more anxious. So a lot of times people are thinking, well, but there's that benefit of the person who's not afraid possibly modeling this very well for them. And that can be true. So that is correct. But usually it goes the other way. They just rev up on their anxiety. So I think people need to be careful and thoughtful about that. And the other thing is, we tend to want to do the one who's not afraid because it's an easy win for us, right? Because if the one who's anxious ends up taking a lot of time, we may never get to the other one. But that's certainly a consideration people should have in a discussion. They might also want to have and engage the parent in, because if the parent is very confident, about their role and how they might help, they can be helpful to inform who you would do first.
And I'm just seeing a couple notes about CHEO Testing Center. Someone saying, sharing that their experience at CHEO Testing Center is that they test, I'm assuming this is for COVID testing, the most anxious first. It's funny you say that. So I worked at camp a few weeks ago and we did rapid tests for everyone. We had children very, very young all the way to adults. And I would say that we've experienced both sides of that as well. So I think it's like any procedure, you kind of have to see what the resources you have available. If parents are also anxious, that also plays into that experience a lot, I think, for the kids as well. But I can certainly agree, Lorraine, from my experience as well. Sometimes doing the more anxious child can be really beneficial too.
There's a great question in the chat about parents who come in with a child that absolutely does not want to be there or vaccinated, and parents know the only way to get them immunized is to restrain them and get it over as quickly as possible. How do you deal with the situation? I'd love to hear the evidence and what happens in the clinic, because I know what we've done.
So Chantal, I don't know if you're seeing that in the clinic, but from our point of view, again, that's not a positive situation. So you want to try to prevent that from happening. So again, people need to know when they're booking their appointment what the expectation is. And part of the expectation is that they know what they're walking into and that their kids know what's going to happen. So certainly from a child developmental point of view or evidence-based point of view, we don't like to surprise kids with needles. It's dishonest. We like them to know what's going to happen, even if it's in simple terms or 5 minutes or 10 minutes before you go and do something, but they really shouldn't walk in not knowing what's about to happen to them. That's not helpful to mental health, and we want to promote mental health. So I would say this is best avoided if you could have these discussions with parents ahead of time to say, in our clinic, this is how we do vaccines, and we don't restrain kids here. So, have that expectation that that's not going to happen. And that if they think that might be needed, that they might want to go somewhere else to try to get more support for their child. That's how I would approach it. I'm not sure, Kristen, if that's kind of your experience on the ground.
So I think there's a difference between a bear hug and a full-on restraint for a kid. For hesitant, worried, a little jumpy, but we're here and we're going to do it, is mom and dad or caregiver will give a bear hug and we all agree, here we go. And then there's a child on the floor and there's a parent holding them down. That's not going to happen. But a bear hug, I'll encourage, and the children will often say, yeah, because they can bury their face into their caregiver and it's over before it starts. If we can get them into that safe position, and that reduces, because there was another question about what if the needle comes out because they move, that reduces the risk for that because it's a good, safe position for everybody.
Yeah, so those comfort positions, everybody should be thinking about in a very serious way, because you're going to want to employ those. So we certainly have resources with pictures that pharmacists can put up in the clinic, actually. And so if parents don't even know what to do, which maybe some of them don't, at a glance, they could get some ideas. But the bear hug you're talking about would be the most secure way of holding a child, right? Where you've got your arms on top of their arms and their legs are kind of straddled around you. And so that's a very nice way to be able to give vaccinations that secures a child, but you're not doing what you said, which is really pinning them down, which really escalates distress to a different level. And those are the kinds of experiences for kids that more likely are going to lead to a needle fear that's long lasting.
Yeah, I would agree with that. I think one of the considerations we really had to think about setting up our clinic in particular was how do we support those types of comfort positions, right? So if you have a very small room and it's very hard to even get in the door, and for say you have siblings coming in the room, even if they're not getting vaccinated, and maybe brother or sister is crying, right? That's not going to promote a positive environment or situation for that child to begin with. So some of those very small things, which seem kind of common sense and pretty intuitive, those can make a really, really big difference. And certainly, I think I would totally agree, Kristen, because I think it's really just how we frame it with the children as well, right? And oftentimes they're going to be more comfortable, sitting on mom or dad's lap or sitting in some of those comfort positions than us trying to hold them down to begin with. And I would say that's the same for almost any painful procedure, not just with vaccines. So that's certainly been something that we've had to kind of think about, is how are we going to utilize the space the best to kind of optimize that experience for them as well.
Awesome. I have a question here about a parent that's interested in using the EMLA patch. Would you recommend that they continue to wear it in the appointment, Any advice on that?
Yes, absolutely. So the time is needed, and this is often the challenge, is it's not put on early enough. You need 60 minutes at least. And then when it's on, it might help us landmark. We need to make sure that we're putting the vaccine in the right place. But it would be really nice if we could hit that. So we'll encourage parents, when they pick up the EMLA, we'll actually show them how to landmark and put that EMLA patch on. I've got some great pictures of my kids with their flu shot EMLA patches on. Also, it generates a conversation when we clean the EMLA off with the child. Like, this is what I'm going to do. Now, can you feel my fingers? And suddenly, oh, I can't feel anything they're doing. It didn't feel cold from the alcohol. It's a great conversation that we can have together and build that trust over those moments prior to the needle going into the arm there.
Okay, so I noticed that we are coming up to the hour. We're going to try to wrap up for the hour. If the panelists are open to sticking around to answer a couple more questions, we'll have that available, hopefully. But before we go, I want to know, what is the one takeaway from each one of you, that if you wanted somebody to walk away from this webinar today with one single pearl, what would that be? And we'll go around.
I guess I can share from lived experience. I would say preparation, just kind of in the broader sense of preparation with those children, having the conversations before, preparation for the families, for them to understand what the process is going to be like, and those expectations of timing and some of those things we've discussed already. Preparation, if that means using EMLA or Maxline or what have you, if there are other strategies that their doctor might recommend, or their pharmacist, if they know really well. You guys might know some of these kids already, right? And so I think just kind of the preparation piece, because as much as we can do beforehand, really makes that end part of the experience, which is getting the needle in the arm, so much easier. So I would say that's probably one of our biggest takeaways for sure.
And I would say that I'd like everybody to know and understand that COVID-19 is a very serious illness, even for children, with lots of potential poor outcomes, not just death, and not just for those who have underlying medical conditions. The vaccines have been proven to be safe and effective in this age group, and it is something that we need to strongly recommend with confidence to our patients.
Yeah, I would echo what the others have said, I would add, prepare yourselves to the pharmacist. So everybody needs to be prepared. Everybody needs to play their cards. Think of CARD as a general framework for anxiety and fear. So if you have your own concerns, worries about the vaccine or about administering vaccines to kids, find out where you could get answers to your questions. So maybe Kristen's answered some of your questions because they have to do with being able to address parents' questions about whether this is necessary at all, or your own worries about whether this is necessary at all, or maybe it's about your confidence in vaccinating children. So what is that going to look like, and how do you prepare the pharmacy? So play your cards. And when you play your cards, you can help others play theirs. It's kind of like, what you hear on the airplane, put the oxygen mask on yourself first before you can help others. So I hope this has been a helpful session for everyone.
That's awesome. You know what? I think the majority of our questions have been answered, and as well as in the written chat box. So I just wanted to thank you so much, all of you, for being here and for sharing your wisdom with us. I'm hoping that the attendees have taken away strategies that they'll be able to implement. I know it's really exciting. The timing of this webinar works out really well. I know people are already people are going to be able to apply this tomorrow. So we're gonna use this as a launching point. There's so much we can continue to chat about in the coming weeks and the months, and I'm looking forward to continuing this conversation. So again, my sincere thanks to the panelists and all of you for being here. And then a reminder to please take a few moments to complete the evaluation survey that will pop up when the webinar ends. The other thing I will mention is that there are so many tools and resources out there. So we've collected them all in one spot, and you can find those resources. You can find them on our website. So check it out. And if you have any suggestions, if you've seen tools, I mean, I think I saw a really cool certificate that you could present to kids after they've got it. So teams are coming up with some great resources. So we're trying to collect them. So please feel free to check them out and share any that you seem to work. So thanks everyone. Have a great night. 6 o'clock. Way to go. Bye.